So I want to just give a couple of very brief examples of what's going on in Africa with mobile health, because there's a lot of really neat stuff going on, and maybe things we can use here, and maybe things we can't. It's really interesting what's going on. Can you just advance this slide, please? Great. So it turns out that the average 13-year-old American kid has more information to health knowledge than a doctor or a nurse in almost anywhere in Africa. It's a pretty sobering thing to think about. But there have been some advances in using mobile devices to break down some barriers in Africa. AED, which is based in DC, has been putting a lot of health information from journals into mobile HTML that then works on mobile phones in the field in Africa. It's nice because the bar charts come over and the data comes over and it's all correctly formatted, so if you are out in rural Mozambique and you need to read about something that has to do with dermatology, you can get the journal article on your phone. So that's a nice thing. In terms of diagnosing things, a lot of people have heard about these clinics where you roll in and they have a webcam which is hooked up to a computer, which is hooked up to the internet. Maybe you roll up your sleeve and you've got something on your arm and they take a picture of it and it's going by Skype to the big doctor in Cape Town and you get the diagnosis back. A couple of guys in Italy ran a controlled test where they took a bunch of different mobile phones, and the only thing they did is they took the phone and they put it right up on the ocular of the telescope, and they took pictures of tissue samples, which some people like to do that kind of thing. And they did, and then they ran a controlled study and ran it past a bunch of doctors, and they found out something like 70 or 75% of the time they had a correct diagnosis from what was going on in the microscope. And that's controlled for the type of sample, whether it was blood or tissue or anything like that, how they stained it. Incredible. And this is just MMS. So you take the picture with your phone, MMS it to the doctor, and it comes back. They're using this in Mozambique right now, and they're looking to push it out into other places. There's an interesting thing in South Africa in public health, where it turns out in South Africa, if you're out of time, you end up sending a text saying, please call me, to someone else. They call you back and they use their meds. This is like 30% of all the cell phone time in South Africa, so it's a big deal. A couple of NGOs then went to the phone companies and said, let's put some public health messages on these text messages in the places where people aren't using them. So they did. Ran a 6-week trial with 2 HIV organizations where were the benefactors of the messages. One organization had 140% more phone calls into the call center about HIV. The other one found out that 98% of the people that called into the call center did so because they got this text. And of them, 40% of those people got more HIV education or treatment. So that's a big win from a really little thing, just little stuff on the bottom of a text message. Slide, please. So there's a couple neat sort of hardware things that are coming around. The thing on the left here was designed by some guys at MIT. In essence, it's a special litmus paper. This is for tuberculosis. So as you probably know with TB, if you've got TB, you're on a 6-month drug regimen. You really can't miss a day. So this is a problem because people miss days, and especially after the 2nd month, they get better. They're not incented to keep taking the drugs. With this, you end up urinating on this little piece of litmus paper, and then the paper changes and it reveals a code. You text that code in to the phone company. If you do this 30 days in a row, you get free cell minutes at the end of the 30th day, and the 60th day, and the 90th day. This has been incredibly effective in really raising drug compliance rates. It was in Africa, but it was so cool I wanted to talk about it. It was Nicaragua, they're doing it in Pakistan now, but they're also looking at Uganda next year. This is MIT. On the right, this is the last thing I'll talk about, so easy on the whistle. So with this is for pneumonia, and pneumonia kills 2 million people a year, somewhat senselessly, little kids. So a guy in Australia sort of hacked together, you can tell this is kind of, hacked together electronics parts, some, cheapo stuff in the middle. I should back up for a second. It turns out that one of the great ways to diagnose pneumonia sort of on the cheap is through blood oxygen level by UV on the finger. You put the UV thing on the finger, you can measure blood oxygen level. That's a great way to diagnose pneumonia without having to get a chest x-ray and a blood workup and things like that. It also turns out, this is amazing, it turns out that the UV, the wavelength of UV that it takes to do your blood O2 is the same UV wavelength in the bottom of a Microsoft mouse that you have on your desk. So the guy took his Microsoft mouse, this, hooked it up into some little, circuitry, put some open source software on there, hooked it up to a phone, and now you've got a mobile pneumonia predictor diagnoser. The best thing is, this thing costs $10 to make. So they're pushing this up in Australia, they're in Mozambique now, they're pushing into Uganda with this, and they're looking for funding to just go crazy with it. But this is, again, the last thing I'll talk about, but it's this idea that, there's necessity in Africa. You don't have the luxury of $1 million machines and all this great healthcare, but you still have to get people treated. And so they're coming up with really new stuff. So some things that maybe we can take away. So I'll take questions at the end. Thank you for listening.